I have 8 questions. I'll state the question and then, of course, the answer. Given the conditionally causal relationship between hepatitis B and liver cancer, do you think that COVID-19 might similarly lead to higher rates of lung cancer? Answer, I'm not aware of any evidence that COVID-19 leads to higher rates of lung cancer, and I seriously doubt that this will ever be demonstrated. COVID-19 causes serious lung function problems, often fatal, but this is different from lung cancer. Second question, any thoughts on the current COVID-19 pandemic possible attack on blood vessels, producing clotting in different organs? Answer, I know of no evidence, and again, I doubt there will be such evidence. Number 3, are you aware of any current studies underway investigating dietary data related to COVID-19 outcomes and deaths? The whole food plant-based diet specifically? My answer, at this time, there is no way to conduct a randomized controlled trial, which many people in the medical profession believe to be the gold standard. That has not been done, and it is highly unlikely that it ever can be done. In such a trial, we would need to investigate individuals already experiencing the COVID-19 response, or who might expect to soon have this experience. One experimental group would be offered the nutrition protocol as in the whole food plant-based diet, with a second group acting as control as required in a properly designed research trial. This type of trial is not possible because such patients are not eating food at that time. This therefore requires a different approach, still very difficult, however. We could compare COVID-19 responses among individuals according to their prior nutritional health if we had that information. This type of study is also unlikely because very few, if any, in my opinion, of those who experience a lung problem will have good nutritional health before the lung response actually begins. I believe that individuals in good nutritional health will not likely present with a severe lung condition in the first place. Question 4. After all the negativity you experienced from Cornell in the past, what does the university say about the very successful plant-based nutrition course? My answer. Before answering this question, I want to be clear about 2 things. First, I had an amazingly rewarding career at Cornell, lecturing to hundreds of undergraduate students and mentoring dozens of graduate students working for their doctoral degrees in my laboratory. I cannot visualize a more enjoyable experience for so many years. Second, on the question of negativity I've experienced at Cornell, I am not speaking about the vast majority of the faculty, and even for that matter, the majority of administrators. Unfortunately, it only takes a few people holding key positions at the university and making decisions beholden to corporate interests instead of campus interests. These interests may be personal, they arise from personal compensation. They may result from a dependency on corporate funding of research and other professional activities, or they may arise from a simple awareness that if an individual faculty member voices a serious opinion contrary to the interests of the external funding agency who pays for professional staff and faculty positions, such critics risk losing their positions, if not protected by tenure. I've had tenure for 50 years, incidentally. There is little that individuals in authority at Cornell could say about our online course because it is highly recognized as the premier such program on this topic in the country. And the graduates of this certificate-based course now number over 50,000. I should also note that online course arose from a course I taught for several years in the Division of Nutritional Sciences at Cornell. Question number 5. It has been shown making available fruits and vegetables in food deserts and nutrition education programs have been ineffective to improve diets in low-income areas. What are best practices and lessons learned based on documented evidence and metrics that have proved effective? What is a web link that describes this with scholarly references? Answer. It is widely known among professionals that it is difficult for individuals to make diet and lifestyle changes of this kind for many reasons. Spouses and other their other family members may differ. Fresh fruits and vegetables are not available in the local market or are unaffordable, or people have not allowed enough time for their taste preferences to change, which may take 1 to 3 months. My own experience, especially in the national policy arena, shows me that the most important reason is the inadequate public information for this type of dietary lifestyle coming from national authorities and institutions. If, for example, the USDA Dietary Guidelines Committee and related governmental organizations really wanted the public to know this information, they could do so. Instead, for decades, these public institutions have been refusing to do this because they are beholden to corporate interests, especially since the 2010 Supreme Court Citizens United decision, 5-4 vote, by the way. Also, medical schools do not teach nutrition, and primary caretakers, especially physicians, cannot receive adequate reimbursement for advice of this kind. I make these comments because a forthright message on nutrition coming from such organizations would go a long way to inform the public. You may find some information on this matter from the nonprofit organization which I founded and which partners with the university online course program. That's nutritionstudies.org. Incidentally, I received no personal financial interest in this organization. Another opportunity is to join a so-called pod, for which there are about 400 pods in the U.S., that's wellness groups, and abroad. It is run by Plant Pure Communities. Again, the web on that is plantpurecommunities, all one word, .org. Question number 6. Dr. Campbell, I have not read your books or delved into the scientific studies that you reference in your very compelling lectures. I'm wondering how many of these studies have specifically looked at fish protein, or whether the inferences have been made that cow protein is the same as chicken, fish, or any other animal-based protein. My answer? There are several studies over the past 60 to 70 years at least showing that fish protein functions about the same way as other animal-based proteins. We should not think about such distinctions, however, in reference to specific chemical or biological difference between these proteins, but about the effect of merely eating animal-based foods on the consumption of all nutrients in the remainder of the diet. They are countless, and they work together as in food to create response. Question number 7. You and other whole food plant-based leaders have made important inroads into public consciousness regarding the benefits of whole food plant-based nutrition in the past several years. But as you point out in the lecture, there remains an active threat from animal industries against education and research. What are the two most important things the average whole food plant-based person can do to support the move toward a whole food plant-based world? As I said above, take the course on plant-based nutrition or possibly join the pod. Question number 8. Obviously, having a 100% plant-based diet is ideal. Would having a small amount of dairy, like half and half in tea, for example, put one over the edge for occasional risk of cancer, increased risk of cancer? Is limited cheese consumption as bad or worse than limited occasional meat consumption? My answer, virtually all seemingly factual scientific statements in nutrition, speaking in a very general way, are based on average estimates, for which there is variance around the mean. I know of no evidence that a small amount of dairy in coffee does harm. Yet I would also ask why someone would want to tempt themselves when there are alternative healthy choices available. The analogy that I like to use is to illustrate my answer is the occasional person, maybe 1-2% of people, who lives to be 90 to 100, who smoked during their entire lives, then claims that they survived because they smoke. Really quite odd. I have to think about the bigger question itself. Thank you very much for your questions, and I wish you well in this journey.